Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Welcome to part 2 of my interview with Dr. Hedva Barenholtz Levy and myself as we were discussing the new initiative called Age-Friendly Health Systems. Listeners, in the next 30 years, the number of folks age 65 is going to double, but our health systems are already struggling to provide evidence-based care to older adults at every care interaction. To be honest, there are frustrations from patients and frustrations from their physicians. 40% of physicians are retiring early or leaving their clinical practice. They cite burnout, workload, and the frustration they have when they have to convince insurance companies to pay for their patients' treatment. They also cite moral injury, which describes the challenge of simultaneously knowing what care patients need, but being unable to provide it due to the constraints beyond a doctor's control. And these are usually systemic issues. Well, I know that a change is needed for all patients, but today we're going to rejoin this interview so that we can learn more about this new senior health initiative. Before we join the interview, let's have a word from our sponsor.
At Family Partners Home, we help residents maintain dignity while promoting well-being. Residents receive 24/7 supervision and care in a home-like setting in assisted living homes that are located in residential neighborhoods. Each home is a single-family home designed and built specifically for those with dementia. For more information about Family Partners Home, 314-686-4468, online at familypartnershome.com. It feels like home. It is a home.
Do you want assisted living services but don't want to leave your home? Call Continuum at 314-863-9912. Our professional team has 20-plus years of experience and will help you create the perfect care solution that meets your current and future needs. Continuum supports independence at every stage of life. Call 314-863-9912 for a free consultation or visit us at continuumcare.com.
Thank you, sponsors. Now let's get to the podcast.
So there's recommendations again for the healthcare professionals, because when we think about this age-friendly health initiative and the 4Ms, we're thinking about it from both the bigger picture, the healthcare systems looking down on how do we improve the care. So from that perspective, we need that education. So the healthcare providers should be educated to do some kind of routine screening for changes in cognition and depression, make sure the older adults have their hearing aids or glasses with them when they're in the hospital setting or wherever their, care is provided. You think about the rehabilitation place or a hospital or skilled nursing, make sure that everything, all the tools that someone needs to be most fully engaged, they have them with them, right? So I'm sure that you've heard many stories or maybe even talked about if someone doesn't have their hearing aids with them, how confusing and disorienting it can be when they're in the hospital setting and they can't hear properly to interact with their care team, right?
Absolutely. I have a friend who has been in that situation, and she said, I'm really having trouble seeing my laptop. And I asked her, I said, well, did you have cataracts? Did you have surgery? And she said, yes. But she said, I ordered new glasses before I had my stroke, and so now I don't have them. And so I said, well, we need to solve that problem. So then the next problem we were trying to solve was hearing, because she couldn't hear what people were saying. So, Hedva's right. That does make such a difference. And my listeners will know that I interviewed a daughter of somebody who was being tested for dementia, but it was the way the test was administered. So the medical assistant had her back to the patient and was wearing a mask. And this is a senior patient. But how often do you need to see their lips move or you need to see their face? But now you're judging my ability cognitively and you haven't administered the test. So this is a key component. And so we want our seniors and all patients to have that access to good test administration. And so if you're the advocate that's going to the appointment with them, bring those things up. Be bold. I'm challenging you. Hedva and I are challenging you to be bold and speak up. And so after this test was administered, the doctor came in and said, your mother has dementia. And this daughter just went nuts, not in a bad way, but just like, how can you say that? This is how the test was administered.
And that shouldn't, in this age-friendly health initiative, where we're really trying to bring it to the forefront of the provider's attention. We have to be age-friendly as we do this to not let that happen. So yeah, that's a horrible story, but an example of
It's
why
just an
we need
example.
to advocate. Absolutely.
Mm-hmm. Yes.
And then with the mentation piece, the good news is that with lifestyle changes, we can kind of preserve our cognitive function. We can, there's a study that was recently published in persons over the age of 65 without any cognitive impairment, no dementia. They were tracked over time with just by following healthy lifestyle interventions. So things like getting enough sleep and enough exercise, having their blood pressure and cholesterol controlled and their blood sugar controlled. I mentioned the physical activity and eating a healthy diet, for example. And these types of healthy behaviors were associated with a lower risk of developing cognitive impairment over time. So I am just such a promoter of what we can do without medications to try and be as healthy as we can. So that's the mentation piece, right? So we can imagine and think about, so I mentioned how medications can affect mentation or cognitive function. If there is cognitive impairment or dementia going on, even depression, that might decrease the mobility, right? So that can interrelate with the mobility piece. So these are all very, very interconnected, which is, I guess, the segue to the fourth M, which is mobility.
Right.
So it's important with this M that the healthcare team and the listeners think about ensuring the patient is able to move safely, to maintain function, and do what matters most, right? So do all those things that we want to enjoy, but how do we ensure that the person has that mobility? So that's everything from making sure the home environment is minimizing risks, right? Doing that fall risk checklist of throw rugs and clutter and all that wonderful stuff. But in the hospital setting, again, really important focus of this health systems initiative, obviously, and in the hospital setting is where we can really control much of this interaction that we have. But ambulating while you're in the hospital, and this is where it's important to have a caregiver with you. Learn how to help the person, the patient, ambulate safely if it's help getting out of bed or into bed or to the toilet. It's important for the caregiver to be involved during that hospital stay, because if the help is needed once the person goes home, the caregiver is trained and has that experience, right? So really thinking ahead of how to promote that mobility piece. And it might start in the hospital setting. It might be someone advocating that the person needs to get up 3 times a day just to move, as long as it's feasible, obviously. But I
Right.
think hospitals are really looking at how to make even if there's IVs or, things that are being hooked up to make that mobile, so the person at least can get up and move around a little bit. So there's a lot of talk about the mobility in the hospital setting. But I'm out in the community. That's where my focus is when I meet with my clients. How can we encourage people to be active wherever they reside, right? So maybe educating the listener. The listener should know that it's important to move. Being sedentary is one of the most, may I say, one of the most dangerous things we can do. It leads to inflammation, which leads to chronic conditions and all that. So I always think a body in motion stays in motion. So how
Yes.
can we encourage people, make sure they know so many minutes per day, per week are important to move and have some type of physical activity, and maybe having that extra motivation, understanding how important it is to stay active and moving as however we are able, right? There's many ways to stay active. That might help with the motivation and fitting it into a routine, making sure it happens every day.
Yes,
So,
I did a podcast, I believe, on lifestyle medicine, and that more doctors are starting to write prescriptions for, 30 minutes of exercise 5 times a day, or, sending people to therapy. And I do think that hospitals are doing a little bit better job in my line of sight on getting people out of bed to see if they can move. But bear in mind, if you're listening to this and you have a loved one in the hospital, anytime you're laying in bed, you start that decline. Then you have an illness or something that you're trying to overcome, or it's a medication, or it's a surgery, or there's some reason, some acute reason why someone went to the hospital. So the factor that they might not be able to move like they did before could be significant, could be minor. They're going to fall somewhere in that perspective. So make sure that if you're the caregiver that's bringing them home, as Hedva said, that you've evaluated that. And if you don't have a good feel about that, then that's something that you need to bring to the attention of the health professional. Has therapy been in to evaluate my loved ones or the person I'm watching over, their mobility? Okay. So having those 4 M's is huge, right? Because you know what those words are. You can remember them easily. I could even say, "Oh, I love M&Ms," and then just have the 4 M's after.
Fall right after that.
Yeah, they just fall right after that. So that's very, very helpful. I appreciate that because when someone is trying to figure out next step, mobility is one of the top questions we ask, because you want to bring your loved one home, but if you cannot work with them in their present condition, that's another conversation. And people improve. Otherwise, they wouldn't call it rehab. So don't be afraid. You just need to know that the resources are available, but you might have to push or ask questions.
Be that little advocate, the advocate, the good squeaky wheel.
Yes.
And then what might be hindering the ability to move around, and I want to bring up pain. Often pain is hindering our ability to be as mobile as we want to. So that then we go back to our medication M. How can the medications help improve the pain to help the mobility? So again,
Yes.
age-friendly medications that might help with the mobility piece, right? So don't be afraid to find out what is the problem, what's the limitation, and how can we address it? Be it pain, you mentioned strength, and the more we lay in bed and not moving, if we're in an acute hospital situation, the physical strength starts decreasing. So how do we regain strength? Balance is key. And then, of course, coming back to the medications that can lead to balance problems, drowsiness, just being unsteady on the feet. Lots of different ways that medications can affect that mobility in a negative way. Of course, pain control is another one in a good way, like I mentioned.
Yes.
So that education and speaking up for how you can help care for your for your loved one who is coming home from the hospital, or for yourself. So just think about aging in place and staying healthy and strong. So that covers the 4 M's. And then we can talk about that the tool, the checklist, if you will, that workbook that can help you prepare for your medical encounter, your medical visit, the doctor visit is the easiest way to think about that.
Do you have a website that I can put it in the show notes for people?
Yes.
But so we'll get the website of where you can pick where you can get that worksheet
Download.
of how you can then get set for your next appointment and start the process.
It's a good little resource, I think. So yeah, we'll put that in the show notes. But I guess I'm trying to think any like summary comments. So I hope it's clear to the listeners the value of knowing about those 4 M's. They're easy to remember, hopefully, and it's a way to help you advocate for better care. And if the more we talk about the 4 M's and age-friendly care, the more it will grow and spread throughout the country. So, because it is a fairly new movement, right? 2017 isn't that long ago, and we're really trying to get it to spread to every place where we receive care.
Yes, I think that when you approach your healthcare team from the perspective that this is who I am, and I understand that this is where I am right now in my diagnosis or what has happened to me. Okay. But this is what I want to get back to. And so that shows that you're somebody different than they're talking to. All right. So right away, you've got their attention. And I say this because some of my listeners know that I had broken my foot in the fall. And so I had to say to my physician, okay, this is what you're recommending. This is who I am. So you think that my age, that I don't do these things. But prior to falling, I had just run a 5K. Okay. I bike, I walk. I'm a very active person. And so this is where I want to get back to. So when he said, you're done, I said, I'm not done because I'm not there. And so then he advocated for therapy for me. So at the end of our time together, the doctor said, you've been a great patient. And I said, thank you. You've been a great doctor. So it was a very positive outcome. He said, come back anytime. I said, no, thank you. I will be happy to refer you, but I would prefer that you and I do not see each other for a very long time or ever again. And don't take that personally.
Exactly. But he got you where you needed to be. And you spoke up, which when you tell that story, it's so important.
Yes. But I was that patient. All right. I did have pain. I did have surgery. And so I did feel a little hesitant to advocate for myself. But the relationship that was developed when I opened my mouth was the big thing. So we're not there to be a problem. We're there. The reason why you're going to your physician is to get help. Now, their job is if you're asking me how I can help you, I'm the expert. I will get you there. But I want to know my risks. I want to know my benefits. I want to know if there are other treatments, and I want to have a real conversation about that. So if that's not available in a 10 or 15 minute increment of time, do I need to come back in for a consultation? Or can we do this virtually, or can we do this over the phone, or how does this work? But Hedva's saying, you're in the driver's seat here. And now the initiative has been launched. 2017 was what you had said. So pre-COVID, this initiative was launched. Do you have any reading of where we are in this as far as this initiative? I mean, it's coming down through to pharmacists, right?
Right. So what's interesting, so through one of my pharmacy associations that has been partnering with the IHI and the foundation, pharmacists are becoming, pharmacies, but also pharmacists can get a badge for age-friendly accreditation, if you will. So that's next on my to-do list because I've been talking about, I believe in it so much. So, if you go to the website, they talk about how many hospitals have picked it up throughout the country, but there's
Wonderful.
always more to do, more to go. But there's just a bigger launch in the last couple of years to really get this out. And I think I mentioned at the beginning that the 4Ms framework is evidence-based. And when I read more about what all that means, um, the foundation in developing what is the framework going to be, what is this health initiative going to look like, they surveyed the older adult care programs that are in hospitals and the community setting to find out what really matters, what improves outcomes, and that's where these 4Ms come from. So knowing that we need to talk about what matters most, the medications, mentation, and mobility, really it's evidence-based, so it's really important. So I was just talk through some of the questions in the workbook. So when you think about like how can I really use this information? I'm going to have a doctor's visit in the next week or whatever. So you kind of the workbook walks you through each of those M's and has prompts for you to answer, if you will. So when you think about what matters most, think about where you are now, what's working, what's important to you right now. And I was also going to mention things change even month to month, depending on your situation, but certainly at every year, you could be at a different place where with what your priorities are, how your health is. So some of this might change for you. So it's important to always rethink it. So, with what matters, what's important to you right now? What has changed since the last medical appointment, last time you saw that doctor?
Okay.
What's going well? What activities do you like to do? What means something? What means most to you? Is it running the 5K? Is it playing music? So just to let the healthcare person know what matters to you. And then also what could be better, right? So
Right.
if there's something you want to look at, how do you articulate that? Write it down and have it ready so you can because we do have to choose priorities. There's a lot that you can put out when you do go through this work, but what could be better? Your sleep, your energy, that you're not yet able to run as far as you used to, right? Things like that. And then anything else you would want to share with the provider. So you just put those thoughts together, which at least starts getting your juices flowing.
Yes.
What's good? What is missing? With the medication piece, same component. What's your situation now? So what are all the medicines you're taking? And as I am a big proponent of including everything you're taking, including your non-prescription and your supplements and things like that. So what is all that you are taking of your medications? What's going well? Where do you think the medications are helping you? And then where do you think you're having some side effects, cost issues? What are the reservations? Even the adherence piece, able to follow the instructions of the medications and take them as they should be taken. If you know you're skipping doses for some reason, it's a middle of the day dose, or it's too expensive, or you're worried about side effects, those pieces of information need to go into the workbook so you're ready to talk to your doctor about them.
All right.
And then, so what could be better? And then what questions do you have? With Mind, there's a series of questions that ask about how happy you are, any changes in your memory, so helping you work through memory issues, depression issues, things like that. What's going well and what could be better, that same type of thing, and what questions you might have. And then the mobility piece, same type of thing. So what's your situation? How do you move around the house now? How do you get from place to place? Are you able to drive? Do you have someone you rely on for transportation? How is that going? What could be better? What are some concerns about your balance, feeling unsteady or being short of breath or things like that? Maybe it's harder to reach things. So what is affecting your life right now with mobility things? So there's some prompts with that. And then once you kind of work through all that stuff, which can be a lot of information, they encourage you to kind of look back at all of your answers and prioritize the top three.
All right.
You have that limited time. What are the top three that might be the most important things to talk about at this visit?
All right.
And so it kind of guides you through that, and bring the workbook with you then. So it just helps you put together, think through those 4Ms, what's most important, what do you wish for, what's going well, and then helps you siphon it out to what is the most important to talk about at this visit. So it's kind of an interesting tool to bring all that together.
I think it's going to be great, Hedva, and I cannot thank you enough for bringing this out so that we can minimize some of our frustrations and that our physicians will feel like they're really helping people, that our healthcare professionals really are completing the task that they have dedicated their education and their time and talents to. So I think this is going to be a win for everybody. How do we get in touch with you if we want to know more about your practice and just to make a connection with you? What's the best way to get in touch with you?
My website is probably the easiest way. You can fill out the contact form and access me there. hblfarm.com, hblpharm.com is my website. And from there is a link to and more information about my book. And I just want to mention that again, because when we talk about tools to help people be knowledgeable and ask the right questions, that's another resource out there for people that I feel very passionate about as well. But yeah, just reach me through my website is probably the easiest way.
Wonderful. I always ask my guests to give us a caregiver tip. Did you think of one that you wanted to share with my listeners today?
Well, this is fun because this isn't necessarily about the medications, and I'm usually always talking about medications, but this is just that different focus about the 4Ms. So I think the tip I want to leave with the listeners is use this 4M framework as you prepare for each visit. We talked about how they're all interconnected. It's a way to advocate for yourself regarding what matters most, especially with that drug therapy. So it applies to any situation, but use that 4M framework next time you have a doctor visit and use it as a structure to advocate for your care.
I think it's so great because if you're a caregiver for somebody, you can ask. That's a great tool for you to make sure that you're advocating what the person you're caring for wants, not what you want or not what the family wants, right? It's what that person has communicated. But then also it helps you to think through your objectives as well. And then everybody wins. And that's what we're after. And I would also encourage you to go back through the seasons that I have of podcasts, because I talk about some of these things that, we're sitting here with Hedva. How many years do you have of experience, Hedva, in your field?
25 years, I guess it's adding up, but over 20 years.
It is. And so, in 20 plus years for myself, and we're not making this up. If I could, I'd take you downstairs and show you my refrigerator. And on the refrigerator, I have the Mind Diet, because when I'm talking about lifestyle, I'm living. I'm trying to live that lifestyle change. So we're just not saying this just because we're supposed to be saying it. We really believe it. And that's why I invited Hedva back on, because she was so passionate about this. I called her back and I said, Hedva, you've got to come on my podcast. Do you have time? So she did that for us today. And I thank you so much. Listeners, this is also going to be a YouTube in case you want to see what Dr. Levy looks like. And we'd love for you to share this with somebody that you know needs this information. So thanks for listening today. And thanks for being with us, Hedva. Thank you for joining me today. Please remember that this podcast is intended as education and not advice. Don't forget to share this podcast with family, friends, or colleagues who want to learn how to age in place, but also share this with those who find themselves in crisis mode. Please go to my website, seniorsupportstrategies.com for more information. When you subscribe to Aging in Place Strategies and Answers, you gain access to premium content and professional tips on creating your own Aging in Place roadmap. As always, I value the time you spend with me.